Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is May 5. The term vaccine passports has been passed around since people started getting their COVID-19 shots. But that term and these passports mean different things depending on who you ask the definition of. So today, two experts are offering their perspectives. They're from two different fields. Josh Michaud, Associate Director for Global Health Policy from the Kaiser Family Foundation, and Laura Elbert is a professor and researcher of Industrial and Systems Engineering from UW-Madison. Thank you both so much for being here today.
Thank you.
Pleasure to be here.
Josh, I want to start with you. Is a vaccine passport literally a passport? And are there other definitions and contexts that we should understand this term to mean?
Sure. It is unfortunate that the term vaccine passport has been the one that's been mostly used in the public conversation around this idea. Because it brings to mind something that, the government issues and is a requirement for travel internationally. When in fact, what the concept that's being discussed here covers a lot more territory than that and is not restricted by those definitions. So what different people mean by the passport can be broken into, I think, two main categories. One is sort of this idea that there is some kind of certification or a pass that people can get to show that they've been vaccinated, which allows them to travel more easily from one country to another. And so instead of right now, much of the international travel is around, requires testing and people to prove that they're negative for COVID to arrive internationally. A passport, as this kind of certification of prior vaccination can serve as a way to ease that process. So if you can show that you've been vaccinated, you can arrive. And some countries are already starting to do this, and we can talk more about that. But another way that this idea of a certification or passport can be used, and some places have already using it this way, is as a way to access certain activities or locations. You need to show that you've been vaccinated in order to access those activities or locations. So, on a domestic sort of policy front, these certifications can be used to demonstrate that people in a certain location or participating in a certain activity have been vaccinated. And that's just a safety precaution. Now, the extent to which these may be required or mandated or anything like that is a whole separate set of questions. And also there's a whole lot of technical questions about how you actually obtain one of these and prove them and how they are trusted among different entities out there. But really the idea here we're talking about is some kind of certification or pass to show that you've been vaccinated. It can be used in different ways.
And Laura, you refer to this broad term as more of a credential, and part of your work is making public systems safer, more efficient, even specifically in health emergencies and disaster response. So can you tell us a little bit about how you as an engineer approach this topic of passports or credentials?
Right. So we have a global health crisis right now, and the point is to reduce and manage the risk. And vaccination is the best tool that we have so far. So the fact that we're discussing what a vaccine passport is, and I agree, it's a credential, it's kind of a good problem to have because we have these really effective vaccines. In terms of managing the risk, international travel is one of the main reasons for this. And having the certification is a separate issue for how they could be used, but they obviously go together. And having this credential really helps us understand who's been vaccinated and who hasn't. And it's a good point that it's not necessarily issued by the government, but there are other credentials that we use, such as driver's licenses, that help with this. And it's a credential that we show. And once you have a driver's license, you can show it in a number of different contexts, many of which do not have to do with driving. And we do have to show an ID when we go to the airport. And an example of a credential at the airport is the Real ID, of having this ID that's kind of a federal ID in the sense that individual states issue driver's licenses, but there's this common credential so we can more accurately verify who's flying. And that's kind of the idea here with the vaccine passport. Those little paper cards that we're given are really for us to use, and they don't provide a lot of trustworthiness in that credential. They're very easily forged. And likewise, the COVID tests are very easily forged. And when you look at, the ability to reduce risk, these credentials that aren't worth nearly as much and are easily forged are of a concern in terms of controlling the spread of the disease. And that's where the vaccine passports, so to speak, can fit in.
And Josh, some are saying that these vaccine passports bring up issues of privacy and equity, but vaccine requirements have already existed prior to COVID-19. What are some other examples of vaccine requirements? And is the COVID-19 vaccine different? Should it be looked at differently?
Well, certainly we're all familiar with the requirements around childhood vaccinations related to entering schools. And there are certainly examples in basically every state and country related to vaccines that are required for certain jobs. So particularly in the healthcare sector, if you are working in a hospital or a clinic or a dentist's office, there are certain requirements for certain vaccinations that employees are required to get. So we know that when it's an issue of public safety, that there is a legitimate and legal construct for states to require vaccinations for certain activities. To date, the debate about whether or not COVID-19 would fit into that framework is still an active one. And already we've seen that certain employers are moving towards requiring COVID-19 vaccinations for the employees. There's a couple of hospital systems, nursing home staff requiring staff to get vaccinated, for example. And now we're seeing universities say that when students come back in the fall, they're going to have to show that they've been vaccinated. And what we haven't yet seen is, say, at a state level, a kind of mandate that people get vaccinated, although there has been some discussion about that. But it does seem like there's an increasing interest and increasing likelihood that many employers and private entities are going to require vaccinations. And so when that requirement comes through, a passport or this certification is a more trustworthy way to show that people have been vaccinated. To date, we don't have, this passport or a pass that has been, vetted for use in the United States, but lots of different organizations are working on such a pass, and eventually I would imagine that we'd get to the point where this pass would be useful in all of those different circumstances, which I said, where we've seen vaccinations be required. Now there's a limit to that, and there's some discussion about vaccination, people having to show that they've been vaccinated in order to, enter restaurants or join normal social activities. There's going to be a limit to, what is required for in different locations, but I don't think that we're going to get to the point where you're going to need to show this kind of vaccination certificate to access sort of everyday activities, but there will be employers, locations, and activities that might need it.
And Josh spoke to these organizations working together on this passport. Laura, there is a consortium of organizations from tech and medical companies. It includes Wisconsin-based Epic, Mayo Health, and even Microsoft. So it's called the Vaccination Credential Initiative. Could an alliance like this help reduce this patchwork of different credentialing systems and locally or globally help them recognize and legitimize each other?
Definitely. And we're going to see this driven by the private sector, and getting a few different companies involved can help with equity issues. But you mentioned the patchwork approach, and that's really important. We want a credential that's trustworthy. We've both spoken about that, but we also want this to be efficient. We don't want a patchwork approach. And if you can just imagine a university checking to see who's been vaccinated, they have students from, potentially all 50 states plus hundreds of international countries. They could have been vaccinated in many different places. The logistics of checking all these individual vaccine documentation is really challenging. You can put that together at an airport where the timeliness is much more important. If all the travelers on a plane were vaccinated in a different clinic, the logistics and the delays and the congestion can be a real problem in and of themselves. And that's where having a credential that can streamline this process, especially when you have a bunch of passengers entering a checkpoint, that can really be something that we can all enjoy. Most people don't enjoy waiting in line and don't like congestion and delays. And that's a second benefit of a vaccine passport.
Josh, we've already seen these vaccine passes at work in New York. It's a free app called the Excelsior Pass. But conversely, Florida has just banned vaccine passports. Similar legislation is trying to get off the ground in Wisconsin from Republicans. People are in kind of camps about this, whether they really want people to prove they've been vaccinated or not. Should people be concerned one way or the other about these vaccine certification efforts?
Yeah, I think there's going to be a continued vibrant political debate about the extent to which vaccines can be mandated, the extent to which different states might allow vaccine passports or restrictions related to vaccination status to be implemented. And we're starting to see that play out, as you mentioned, in Florida, the push against using any kind of passport. Whereas in New York, they've already embraced this idea to an extent. Because of the way our federal system works, it's really going to be a state by state decision, just as the decisions are now around school-based vaccination requirements and other public health rules and regulations are decided at the state level. This is going to be a state by state basis, which also raises the concerns about a patchwork here. So if the New York system is not adopted elsewhere, or if you're in one state and go to another state, are you going to have to juggle two different systems to certify your vaccination status? That's something that we already mentioned. But I think that's to be resolved as far as the legality of these and the extent to which they can be required or imposed. It does seem like there is a groundswell of interest among many private employers, as we talked about the universities, but also large employers, having some kind of proof that if not all, most of their employees have been vaccinated before they go back to the office. So there's certainly an argument to be made on both sides here, and different states might come out in different places on this spectrum of acceptance of these vaccine passports.
Laura, in terms of efficiency, how much of this depends upon individual human behavior? We can't even seem to agree on whether or not we should keep wearing masks. Wisconsin tried to encourage people to use this contact tracing app, and it didn't really take off. So how much should efficiency be determined by human behavior and incentivizing people to actually use some of these things?
Yeah, human behavior is such a critical part of every system, isn't it? I definitely see some carrots and sticks that could be involved. And, a vaccine credential can be viewed as more of a requirement or a stick, but there's also a lot of incentives. Some incentives have been really interesting. I've seen employers give employees time off or pay them for, 4 hours to go get a vaccine, which is really nice. The state of West Virginia is giving everybody a $100 bond, I believe, to get a vaccine. I think this is a really great approach to encourage public safety. we've seen other things that are not really carrots or sticks, but just trying to reduce the transaction cost of getting a vaccine. And this can include the opening of these mobile clinics. Sometimes vaccines have come to an assisted living facility, for example, so people don't have to travel. It's hard and time consuming to find time to get a vaccine and then come back 3 weeks later. So all of these efforts together can make a real difference, and I hope that they do.
Josh, we're already seeing some of our local sports teams in Madison here offering vaccinated only sections. And currently, if you do travel and you're not vaccinated, you have to show that you test negative for COVID-19. So is there a possibility that proving whether or not you've been vaccinated would be required? Getting vaccinated would be required, possibly federally? Or are these passports merely just a way to encourage people, almost like a TSA pre-check as we're getting things back to normal?
Right. Yeah. And I think that there is a spectrum of outcomes you could expect here, either from a very strict, mandate and the use of passports to prove that you've met the mandate requirements, to a much more, voluntary basis. So, I think the Biden administration has already come out saying that there's going to be no federal issuance of vaccine passports, or there's almost impossible to imagine a federal mandate for COVID-19 vaccinations. That's very unlikely to happen, and they've already said that they're not going to be pursuing that. Instead, letting the states lead on this, and then on the private side, private sector consortium, like you had already mentioned, in developing the actual certifications themselves. I think the federal government will play a role in terms of monitoring how those are going and making sure that they meet federal guidelines, but without any direction or requirement coming from the federal government. So that means that you're left with private entities such as sports teams or governments putting in place certain incentives. And I would imagine a vaccine-only section of an audience, or in a sports stadium, to be a kind of incentive for people. If it makes it easier for people to attend, then that's an added incentive for them to get vaccinated, and also to show a certification if that is what is used to access that. So we're likely to see more and more of those types of incentive structures, whether or not they're designed as such. They probably have the effect of inducing people to get vaccinated, and also drive this effort to develop certifications which are trusted and useful across different jurisdictions.
Laura, we have a big economic driver coming up, which is the summer tourism season in Wisconsin. Is this something that could help jumpstart or just kind of get some life back into a big part of our economy, and especially in the tourism industry, as people are either touring around the state or coming from out of state into Wisconsin?
Absolutely. I think last summer we looked at whether or not to travel, and not traveling was the right decision based on what we knew last year. And now it's how we travel. We've seen some CDC guidelines for travel that means that travelers don't usually have to quarantine if they've been fully vaccinated. They don't need to be tested before flying, but many travelers have been tested before traveling to another state. So this vaccination can help reduce that. And having that credential, if you have to show it at the airport, is also useful. It's an important tool. And I want to piggyback on something said a moment ago. There is a bit of a credential in Wisconsin. We have the Wisconsin Immunization Registry, which is really nice. You can download your vaccines. But if you haven't been vaccinated in the state, you can't really do that. And most of my childhood vaccines were from another state. Incidentally, we do have to show other vaccines for certain types of activities, including travel. When I went to Germany on a Fulbright, I needed to prove my vaccination status for many of the childhood vaccines, and I didn't have those records handy. And it took a few visits to my doctor's office to get some booster shots to kind of get over the hump because we were missing that information. So these transaction costs of if you think more broadly about vaccination and public health, something like a vaccine passport can really help us manage some and reduce some of those costs.
And if I could
Josh is, yeah, go ahead.
I was going to piggyback on that idea. And in terms of existing models and requirements on the international travel side, of course, the model that's often been demonstrated or talked about as something which we might see with COVID-19 is the yellow fever vaccination certificates that people have to show to travel to certain countries where yellow fever is a risk. So people carry an actual physical card with them, which demonstrates that they have vaccines. In the past, we had shown other types of vaccinations like smallpox and et cetera. So, this idea of a certification exists to some extent already. Now, in the international sphere, as we know, there's differentials in terms of access to vaccines right now. So any kind of system that requires or makes it easier for international travel for people who have been vaccinated when there is so little access for people in other countries, many other countries, to get vaccinated right now, does raise questions of equity. And that's one of the major concerns that the World Health Organization raised about using vaccine passports internationally right now. And so they haven't recommended their use yet until there's more equity in terms of access for COVID vaccinations.
And Josh, is politics going to complicate all of this?
Yeah, this is a public policy that's going to have to be debated and decided in the public sphere. And so politics is already part of it and will continue to be part of it. I think that means that, where these decisions are being made, often at the state level, there's going to be ongoing debate about both mandates for vaccines and where those can be applied, and how to navigate this certification system and which systems to use. And all of that is going to place on policymakers a lot of a big challenge in terms of deciding on how to get through all of these thorny questions, because there are such right now passionate beliefs on both sides here that they can be helpful and they can be good in terms of easing the process to normality, or they can be seen as something which is negative and should be fought against. So certainly I would expect there to be continued political debate on this. And we haven't resolved this, I don't think, anywhere in the United States yet.
Laura, some countries like Israel's Green Pass have already started to develop requirements, and I imagine other countries are in development and going to be releasing their requirements soon. Will that kind of global pressure force the United States and other countries to kind of figure out their own system, almost kind of like trickling down, so that it does kind of become like a passport or another form of ID?
I think it will. I mean, it will create a big incentive for each country to develop a credential that can be trusted and used worldwide, especially as we see the variants emerging from different parts of the world. This virus is going to be around for a long, long time, and so there's going to be ongoing challenges to manage it. But as we pointed out, that we're in transition. We're going to develop some things. There's a lot of nuance in the conversation, and where we will be in a month or two from now is not going to be the same place where we will be from a year from now or even 5 years from now. So there'll be some ongoing discussions, and it's important to have a lot of voices and a lot of voices heard at the table, and then we can sort through some of that nuance.
All right, we need to leave it there. And you said there's a lot of nuance, so I want to thank you both for adding some context to this very nuanced discussion. Thank you both for being here today.
Thanks for having me.
Thank you. Pleasure.
For more from Here and Now in PBS Wisconsin, you can visit pbswisconsin.org. And thank you so much for joining us on Noon Wednesday.